Well, thank you for having me. I'm very proud to be here. And I just want to say that I'm director of the Licensed Home Care Service Agency, LICSA. And our main goal is to provide healthcare services to the ALP residents right now. Eventually, I will be going into the community, but right now we're focusing on just serving the ALP. Okay, as Paul said, it's a 100-bed unit. We provide many services, one of them which is Kelly Lanzone. We contracted with Helping Hearts at Home for anybody who needs a companion. I'm in the process of hiring certified home health aides to service the building and the residents for their ADLs, meaning their activities of daily living. Okay, meaning that if they need shower, they need toileting help, meals, they could be assisting with their meals, transferring, anything that the patients may need, the home health aides will provide. We also contracted with many companies and organizations for anybody who may need physical therapy, occupational therapy, respiratory therapy, speech and language pathology, audiology, nutritional services, and also social work if anybody needs social work. So right now, that is our main goal, is to provide the services. I can't wait to work alongside Paul and his team. We have a great team right now. Ruby, our RN case manager, Dana, social worker case manager, Kelly, our director of recreation. We're all a great team right now, and we can't wait to open our doors and get started.
That's good.
Yeah.
Well, Lorraine, you have a bit of a background with St. Johnland.
Oh,
How
yeah.
long you
Talk
been
about
there?
continuity.
Talk to us
Yeah.
about how long
February, I'll be there 18 years. I did 15 of my years in the adult medical model daycare, which Mary Jean had mentioned, and hopefully they'll be opening up again soon. When they did close for the pandemic, I did go upstairs to the long-term care. I was an RN PCC float, and then I got a permanent position on what we discussed, the KIP unit, which was the dementia unit. It was a very challenging unit, but I loved it. And so, yeah, I'm proud to say I'll be celebrating 18 years at St. Johnland.
You know, and that's quite interesting, Lorraine, and a compliment to you, Mary Jean, is I always think there's a value to promote within an organization, to migrate a person from one level to another level. Lorraine's a classic example of
And
that.
I agree. I think that when people work with you for a period of time and gives you the opportunity to see their qualifications, the quality of the person, and that when that opportunity arises, I think that it is key to be able to keep them in your organization and to promote them for the good work that they have done.
Yeah, that's true.
And I just want to add, I did contract with the Visiting Nurses Service. So, for example, if a resident needs to go out to the hospital, gets a surgical procedure, comes back, and needs a bit of a high-leveled skilled nursing care, that's where the CHA will come in. CHA meaning Certified Home Health Agency, and that's what VNS does. So that's another contract that the LICSA will be working with.
And you know, why don't you, since you're talking about that, why don't you talk about one of the things that all licensed agencies have to have is a QI committee, Quality Improvement Committee. Why don't you talk a little bit about your committee, Lorraine?
Well, my Quality Improvement Committee, I feel, is one great committee. I've done 3 quarterlies so far, and I have 12 members, and I've had 100% attendance and cooperation. And we discuss any kind of quality improvement measures. Right now, being we're not open, we have no patients to discuss, but in the future, that's what we'll be discussing. Any, quality of measures that we can use to improve our patient care. We have somebody from the therapy company, Therodynamics is another contract, and Jason Romano, who's the CEO, joins our committee. We have Kelly Lanzone, our committee for our companionship. I got Paul from the ALP. So we have a very nice built committee, and I'm very pleased to say that I'm happy with it.